students. Today we are going to discuss about the autonomic nervous system. First of all, there is an introduction to ANS. We know that our nervous system is divided into central nervous system and peripheral nervous system. Our brain and spinal cord constitute the central nervous system, and the peripheral nervous system consists of somatic nervous system and the autonomic nervous system. The autonomic nervous system consists of sympathetic system and parasympathetic system. The sympathetic system is also known as the adrenergic system, and the parasympathetic system is also known as the cholinergic system. When we are stressed, our sympathetic system is activated. The main neurotransmitter involved in the sympathetic system is noradrenaline or adrenaline. It is the agent which helps us to fight or flight response. The parasympathetic system is also known as the system of rest and digest. The main neurotransmitter involved in parasympathetic system is acetylcholine. Normally, there is a balance in between the sympathetic system and the parasympathetic system. As a result of activation of sympathetic system, there is dilatation of pupils occurs, and there is also acceleration of the heartbeat. It inhibits the digestive activity and stimulates glucose release to get more energy, and also stimulate the secretion of epinephrine and norepinephrine from the adrenal gland. The parasympathetic system causes contraction of pupil, it slows the heartbeat and also stimulates the digestive activity. What are the common drugs acting on cholinergic system? The prototype agent is acetylcholine. You can classify the drugs on parasympathetic system into parasympathomimetic or cholinergic agonists and parasympatholytics or anticholinergics. Parasympathomimetic means these drugs will mimic the activity of acetylcholine. Parasympatholytics means they inhibit the actions of acetylcholine. First of all, we have to look more detail about the parasympathomimetics. We have to study about the synthesis, storage, release, actions, and metabolism of acetylcholine. This is the structure of a synapse, which consists of a presynaptic neuron and a postsynaptic neuron. The space between these two neurons is known as synaptic cleft. There is uptake of choline take place into the presynaptic neuron. In presence of acetyl coenzyme A, is converted to acetylcholine. It gets stored in a synaptic vesicle. When there is influx of calcium ions, it will cause contraction of the synaptic vesicle, which will result in release of acetylcholine into the synaptic cleft. These acetylcholine will act on the receptors present on the postsynaptic neuron. The receptors can be two types, muscarinic receptors and nicotinic receptors. The acetylcholine is metabolized by the enzyme acetylcholine esterases into choline plus acetic acid. There are two types of cholinergic receptors. These are present on the postsynaptic neuron. The receptors are muscarinic receptors and nicotinic receptors. There are 5 types of muscarinic receptors: M1, M2, M3, M4, and M5. The M1 receptors are mainly present on the central nervous system. The M2 receptors are present on the myocardium. The M3 receptors are present on our smooth muscles. and M4 and M5 are present on the central nervous system. The nicotinic receptors are of two types, NM receptors and NN receptors. NM receptors are present on the neuromuscular junction and the NN receptors are seen in the ganglia and adrenal medulla. Classification of parasympathomimetics. They are classified into directly acting agents and indirectly acting agents or anticholinesterase. Directly acting agent means these agents bind to the corresponding receptors and produces cholinergic activity. The agents can be a cholinesterase like acetylcholine, beta-anacol, or carbachol. Some of these agents are alkaloids, which include pilocarpine and muscarine. The indirectly acting agents are anticholinesterases. That means these agents inhibit the activity of acetylcholinesterase enzyme, thereby inhibits the metabolism of acetylcholine. The agents can be reversible inhibitors or irreversible inhibitors. The reversible agents are physostigmine, neostigmine, pyridostigmine, hydrophonium, rifampicin, and donepezil. Irreversible agents include organophosphorus compounds and carbamates. The acetylcholine is the prototype drug, but it is not clinically used because it is rapidly degraded by the enzyme acetylcholinesterase. We have to study about the introduction of acetylcholine, mechanism of actions, pharmacological actions, adverse drug reactions, uses, contraindications, and common drug interactions. It is a parasympathomimetic drugs and it is a cholinesterase. The mechanism of action of acetylcholine is they act on both muscarinic and nicotinic receptors and produces cholinergic effects. The mechanism of muscarinic receptors is the muscarinic receptors are G protein coupled receptors. When the acetylcholine bind to M1, M3, and M5 receptors, they link to a protein known as G2 protein. As a result of this binding, it will stimulate phospholipase C and increases the level of inositol triphosphate, diacylglycerol, and also causes increase in calcium ion concentration. Acetylcholine also binds to the M2 and M4 receptors, but these are linked to a protein known as GI protein, so that they inhibit the adenyl cyclase enzyme, so there is reduced release of second messengers like cyclic AMP. Then about the nicotinic receptors, these are ligand-gated ion channel. That means when a ligand will bind to the receptors, the channels get activated and results in influx of some ions. Here the ligand is acetylcholine. When the acetylcholine will bind to the receptors, causes activation of the ion channel. Here it allows the influx of sodium ions and there is increasing concentration of sodium ions into the neurons. They act on both receptors, muscarinic receptors and nicotinic receptors, and produces cholinergic effects. Then what are the effects of acetylcholine? It has both muscarinic effects and nicotinic effects. The muscarinic actions are mainly seen in the eye, myocardium, smooth muscles, and exocrine glands. We know that our iris consists of two types of muscles, circular muscles and radial muscles. The circular muscles are innervated by the M3 receptors and the radial muscles are innervated by the adrenergic receptors. When the acetylcholine will bind to the M3 receptors present on the iris, it will cause contraction of circular muscles and produces miosis. And if adrenaline is bind to the receptors, it will cause contraction of radial muscles, still leads to mydriasis. That means dilatation of pupil. Here, the acetylcholine will cause contraction of circular muscles, which leads to meiosis, and the adrenaline causes contraction of radial muscles and produces mydriasis. Effect of acetylcholine in our eye. The type of receptors are M3 receptors. When acetylcholine will bind to the M3 receptors, it will produce meiosis, that means contraction of the circular muscles of the iris, and spasm of accommodation due to the contraction of ciliary muscles. It also helps to reduce the intraocular pressure by increasing the drainage of aqueous humor due to the meiosis and ciliary muscle contraction. Then what is the effect on heart? In myocardium, the type of receptor present here is the M2 receptors. By the activity of acetylcholine, it causes cardiodepressive effects such as reduced heart rate, reduced force of contraction, and reduced AV conduction. Effect on lungs. It will cause contraction of the bronchial smooth muscles and produces bronchoconstriction. They act on the M3 receptors present on bronchial smooth muscles. About GIT, the receptors present here is also M3 receptors. Increases the GIT motility and produces colicky pain, and that also increases the peristaltic movement and relaxes the sphincter and facilitates defecation. In urinary bladder, acetylcholine again acts on the M3 receptors and causes contraction of detrusor muscles and relaxation of the trigonal sphincter and produces and facilitates urination. Regarding glands, acetylcholine increases the secretion from all glands such as salivary gland, sweat gland, lacrimal gland. It also increases the gastric and tracheobronchial secretions. Then about the nicotinic actions, there are two types of nicotinic receptors, NM receptors and NN receptors. On skeletal muscle, acetylcholine will cause contraction of skeletal muscle by acting on NM receptors present at the neuromuscular junctions. Then what are the adverse drug reactions of acetylcholine? We have muscarinic adverse drug reactions and nicotinic effects. These include diarrhea, urination, meiosis, bradycardia and bronchospasm, emesis, lacrimation, salivation and sweating, GIT distress and colicky abdominal pain. You can remember by this adverse drug reactions in mnemonic dumbbell sleep. Then about the nicotinic effects, produce muscle twitching, fasciculations and weakness. Then what are the uses of choline esters? The prototype drug is acetylcholine, but it is not clinically used because it is rapidly metabolized by the enzyme acetylcholine esterases. Then another agent is methanacol, can be used for the management of paralytic ileus. In case of paralytic ileus, there is reduced GIT motility, so we can increase the GIT motility by use of methanacol. It will act on the M3 receptors and increases the gastric motility. So it can be also used for the management of post-operative urinary retention because they act on M3 receptors in urinary bladder and causes contraction of the detrusor muscles and it improves urination. Then can be also used for dry mouth and xerostomia because it increases the secretion from salivary glands. So this is a xylagogue. Xylagogue means agent which increases the salivary secretion. Then there is another agent that is pilocarpine. Chemically it is an alkaloid. It is obtained from Pilocarpus microphyllus. Chemically, it is a tertiary amine. It can cross the blood-brain barrier. It mainly have the muscarinic actions. Then the adverse drug reactions include pulmonary edema, and it also includes all other adverse drug reactions of acetylcholine. Then what are the uses of pilocarpine? We can use it for the management of glaucoma, Glaucoma is an ophthalmological condition characterized by increased level of intraocular pressure. Why we use pilocarpine for the management of glaucoma? Because it reduces the intraocular pressure by increasing the drainage of aqueous humor by meiosis and ciliary muscle contraction due to M3 receptor stimulation. Then glaucoma, in case of glaucoma, we can use pilocarpine occlusert. Occlusert is a newer drug delivery system. Then we can also use it for the management of dry mouth and xerostomia due to synagogue action. Then another agent is sevimelin. It is a newer drug selectively acting at M3 receptors in lacrimal and salivary gland epithelium. So it has longer lasting synagogue action than pilocarpine. Then what are the contraindications of parasympathomimetics? Cannot be used in case of bronchial asthma because it can cause bronchoconstriction by acting on M3 receptors present on bronchial smooth muscles. And it is also contraindicated in septic ulcer because the parasympathomimetics increases the gastric acid secretion. It will worsen the septic ulcer. Okay, so these are all about parasympathomimetics. We have to study about the classification, mechanism of action, type of receptors, uses, and adverse drug reactions of parasympathomimetics.